right, welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Trisha Swift. She is an advanced practice nurse and a healthcare executive. She wrote the Kevin MD article, The Future of Whole Person Care, High-Tech Holistic Medicine. Trisha, welcome to the show.
Thank you for having me. I'm glad to be here.
We'll get into your article in a little bit, but first off, can you just share your story and your journey to where you are today?
Sure. Yeah. So I have a nursing background. Obviously, I grew up in the hospital and integrated healthcare system setting, rose through the ranks in those settings and grew my role into overseeing quality, safety, and regulatory aspects of care delivery. And from there, moved on to management consulting and applied those skills in other settings and helped other organizations sort of figure out how to best deliver care in an integrated way. Today, I work for a pop health management software company. We service the insurance industry primarily, working on whole person care and how to integrate digital technologies into that. And so as I look at my career and sort of what I've been through, I've started to shift my focus a bit on addressing the things that make us sick instead of trying to make symptom management as good as it can be. So same realm, but different perspective, different corner of the arena.
So talk a little about that transition from clinical medicine to your current role in a non-clinical application of what you do.
Yeah, so I transitioned from the bedside. I was working in perioperative medicine and transitioned into quality right around the time when core measures and meaningful use and all those sort of legislative things came down. And it's funny you asked me this because I had friends and family say, oh, so you're not going to be a nurse anymore. And it was, something I had to explain where, being a clinician can look very different. You don't always have to be at the bedside. What makes the care delivery system run is all of the supportive roles plus the front line. And that's where I really found my calling is having a bit of a broader brushstroke while still holding true to what I understand of what the front line has to deal with so that we can truly start to redesign and transform our system into offering the best care that's possible.
Now, were there any challenges that you had to overcome when making that transition into management consulting?
Absolutely. In management consulting, there's very few clinicians in the group. And so that actually was an extremely challenging transition for me to be surrounded by, very competent and educated business leaders in healthcare, but had no understanding of how care was applied and delivered. And so when you're designing strategy or selecting technology tools and designing that portfolio, having that perspective lacking at the table was a gap that I wanted to fill, but I was usually the only one there to speak to that perspective. And so being the small voice, but a very important perspective at the table really opened my eyes. And I advocate all the time. I think more clinicians need to come over on this side of the world because our voice is drowned out if we're not there.
Now, did you have any prior training before making that transition into management?
I did, yeah. So I have a doctorate of nursing practice. I got that at the University of Iowa, and my focus and my specialty within that program was in health systems. So the academic preparation I had was on designing health systems, managing them and transforming them to be best positioned for future care delivery and all that entails there. So lots of business training, nonprofit organizations, ethics courses, legal risk, all of that was part of my academic preparation.
All right, so let's transition now into the Kevin MD article that you wrote. This was back last August, and it's titled The Future of Whole Person Care, High-Tech Holistic Medicine. Now, for those who didn't read that article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah. So I'm particularly interested in preventative medicine. I'm currently working on my second master's degree in Ayurveda and integrative medicine. And when you think about what it means to be preventative in nature, your mind is naturally drawn to things that are organic or natural, yoga and wellness and eating healthy and things of that nature. And usually thinking about technology in that context doesn't naturally come. And so as someone who's currently working in the tech industry, but with that passion and that interest on that side. I wanted to just, for your audience and anyone else who's willing to listen, is sort of bring together that, applying holistic medicine and being preventative in an approach is absolutely synergistic with technology. And there's many digital therapeutics, analytical platforms, and things of that nature that can help us apply whole person care in a more effective way that makes it tangible for the consumer themselves.
So please share some examples or stories of that intersection between holistic medicine and technology that's either coming down the pike or that may be available already that a lot of clinicians may not know about.
Absolutely. I'm going to focus on AI for this one. So in order to understand the vulnerabilities and the things that make us sick, we have to be able to measure that and analyze that, because there's so many things that one could focus on, and knowing sort of what to zoom in on and what's going to be effective, analytics helps support that. So, stratifying populations is one example of where advanced analytics is really helpful. And what I mean by that is sort of taking data that's publicly available, perhaps through governmental agencies or just in your local municipalities, water quality, air quality, access to transportation, distance to healthcare, things of this nature. You can sort of analyze what those are, not only at a zip code level, which a lot of people focus on, but even zooming in farther and looking at census tract level down to your neighborhood. And then you can start to understand where vulnerabilities and disparities lie by using and consuming those data. And then from there, you can risk stratify populations and segments within communities, and then begin to understand what's going to be most impactful based upon the results of what those vulnerabilities and disparities say within using those analytics. And so that's just really sort of retrospective analytics. Mm-hmm. But from there, you can start to build and use machine learning to build predictive models and begin to understand, what is the correlation between, food deserts and diabetes, or education level and smoking habits. And you can start to predict what people are at risk for in the event they don't change behavior, or in the event that vulnerability gap cannot be closed through their provider team.
So I'm an internal medicine primary care doctor, and I know a lot of things that you do are on a population level. But let's say for me in the one-to-one in the exam room, what are some specific tools that I can use? What are some specific resources that I can look up to implement and use some of the things that you're talking about?
So one just really fundamental way to get started on understanding how this is impacting your panel is just do the screening and ask the questions routinely, twice a year, once a year, and use that data to analyze your own panel to understand where their vulnerabilities are. So, understanding what their social context is, what sort of support they have, screening for social isolation, assessing means for transportation, access to food. And this can get a little complex too, because sometimes our patients don't understand what we mean by access to food. What we really mean is access to nutritious food, not Burger King or, bags of Doritos, but perhaps, do you have fresh fruits and vegetables? Do you have milk? Do you have whole grains? And so just sometimes collecting that as part of an intake assessment or an annual physical exam can start to unveil where those gaps and vulnerabilities are that you might not otherwise be made aware of if you didn't just simply ask the question.
So you mentioned about artificial intelligence being one technological thing that is current now. What else is coming down the pike, from a primary care setting? What are some of the things that we have to look forward to in the future?
Well, I think, there's a big trend to sort of transfer risk of managing patients to the primary care physician. And I think that sounds good on the surface, but it's so much more complex than that. And of course, primary care physicians need their patients to engage in that healthcare journey in order to feel comfortable in owning that risk. And so this whole concept of engaging your patient and understanding sort of what it means on the psychosocial level to engage patients, what they need to be engaged. And, some people can say, well, they need to own it, or they need to feel connected. And that varies based upon the person. What does connected mean? But it's really confidence, and it's education, and it's understanding where actions and behaviors and compliance can factor into their health. And so there's a big movement on consumer engagement and what it means to engage a consumer, and how wearable devices and lifestyle nudges, they call it, how can we insert a health or a wellness nudge into the day-to-day sort of lifestyle of patients. But I'm excited to kind of see that segment grow, because I do think it's not feasible long-term to just transfer risk to primary care and wait and see what happens. We have to have the patient sort of engage and own some of that risk too. But creating that nuance and that precise and customized approach, I think is where the devil's in the details, and what that means for different, population segments and risk cohorts as well. If you're low risk, if you're young and relatively healthy, the goal is to keep you there. We don't want you to emerge in risk. And so it's easier to engage that segment. But if you're someone with multiple comorbidities and 25 different medications to manage, and you're elderly and you're not as tech savvy, that becomes even more difficult. But teasing out what that looks like and creating those really custom care plans, I think is what's going to help us sort of really get into that value-driven delivery.
Now, we're talking in the beginning of February, and we're about 1 year into the pandemic. Now, how has the last year during the pandemic changed or influenced what you're seeing from a population level, and what you're seeing in what you're doing in that intersection between healthcare and technology?
So I think, the COVID pandemic has illuminated this understanding that our social vulnerabilities and our social determinants really do impact health. I mean, we're even seeing that today on who gets the vaccine and who doesn't, and whether it's appropriate to prioritize vaccine to elderly or to frontline or to those with comorbidities, sort of which approach should we take. But I think overall, illuminating that vulnerabilities, people of color and people of lower socioeconomic status have indeed been at higher risk, have higher mortality rates. It has allowed us to better understand that these things aren't just for preventing diseases, but even in a public health crisis and in a very acute setting, we're seeing the social determinants of health make a difference in your outcome. And so there's been even more interest in applying some of those advanced analytics and using artificial intelligence to better understand that. And then also sort of understanding how can we use some of those more not bleeding edge interventions, but how can we apply different nutritional care plans? How can we use sort of phytonutrients? How can we address gut health? How can we address brain health in order to lower the risk of patients for these, viruses that come out in public health crisis, but even in, managing and preventing their diseases as they move forward as well, and comorbidities associated with that.
Now, is there an anecdote or story that you could share about how what you're doing with population management affected patients individually in a specific community?
Yeah, we do a lot of work at Z Omega in, understanding populations and stratifying them. And we have some really neat artificial intelligence models that can address sort of boutique needs that health plans might have if they have a problem in a particular area that's not commonplace across the nation. We can kind of zoom in and help them. So one of the models that we have are related to predicting the likelihood for opioid overdose. And I think, a lot of people assume that opioid overdose is secondary to having prescriptions for opioids and having access to them. And when we kind of took in real patient data, not synthetic data, which is common when you're building AI models, but we used real patient data, what we learned was the opposite of that, where those patients that were overdosing on opioids didn't have a prescription at all. They had other things that made them at higher risk for overdosing, such as, increased ER visits. I mean, multiple ER visits over and over and over, where they're hopping and they're getting different prescriptions, or their socioeconomic status, or the fact that they may have had some sort of recent traumatic event, or death in the family, or things of that nature. And so I think if you look at that, where if you're trying to manage a care management workflow, or you're trying to monitor patients that are on opioids and make sure they don't get too much. But if you apply the advanced analytics on top of that, and then you understand, well, these patients don't have a prescription to track at all, then the approach you take at preventing overdoses and poor outcomes and prolonged lengths of stay in an ICU, the approach you take is different, because now you automatically exclude those with opioid overdoses, and you look at different things that put them at risk.
We're talking to Trisha Swift. She's an advanced practice nurse and a healthcare executive, and she wrote the Kevin MD article, The Future of Whole Person Care, High-Tech Holistic Medicine. Trisha, my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Sure. So I think, a take-home message regarding high-tech holistic medicine is that in order to offer holistic medicine, we need to start to integrate technology and use the different things that help address the vulnerabilities that make us sick and help customize interventions to also pull in the things that make us unique as a person. And so, if we look at emotional health, spiritual health, brain health, nutrition, gut health, the microbiome, your social support system, and all of those things, while traditionally we think of those as sort of alternative and complementary, they can indeed be the front end of preventing disease and reducing your risk for becoming infected with a virus or having your comorbidities progress to a point where they're unmanageable and they lead to unexpected mortality. So I'd like your audience to sort of think about these things in a more front-facing way and maybe start there and back into some of the more acute interventions, because it's just going to help patients overall be able to own their own treatment plan and not have to reach outside of their ecosystem to be healthy and well.
Well, thank you so much for sharing your time and insight, and thanks again for being on the show.
Thank you.